Well, good morning, everybody. It's Joanna here. I am a dietitian at Everyday Nutrition, and just quickly, um, we specialise in helping people who have got digestive problems find their food freedom again. So that's what we're all about at Everyday Nutrition. Um, this morning, I just wanted to pop in and say hi, and I thought we'd have a quick chat about constipation. Um, Constipation is one of those things that I know can be very uncomfortable. It can be quite debilitating. So it's one of those things that we kind of want to get on top of, but it's also something that doesn't really fish under polite dinner time conversation. So it doesn't really get talked about that often. So without further ado, constipation, what is it? So by definition, it would be the passing or of hard or dry stools. The stools may be infrequent, they may be difficult to pass, or you may be left feeling like unfinished afterwards. So um, over time, that can build up, that can back up through your intestines, that can get really uncomfortable, it can contribute to bloating, it can contribute to cramping and just general discomfort, which is never very nice. So before we talk about too much about the constipation, I want to talk about what's normal and what's not, because there's a bit of misinformation about this, and sometimes there is a bit of misinterpretation. So anything from 3 times a day having a bowel movement, or anything up to once every 3 days, would be considered within the range of normal. So there's a really wide range of what we consider normal in terms of how frequent you should be having a bowel movement. It's actually What's actually more important is not how often you're going. If you're going in anywhere in that range, and you are comfortable, your stools are easy to pass, and you're left feeling satisfied at the end of them, then we would consider that absolutely normal. What I'm more concerned about, if somebody's going once every 2 days, but the stools are small and hard, they're difficult to pass and they cause pain, then I would be concerned about it. If they were going for longer than 3 days without having a bowel movement, then I'd be saying, okay, what's going on here? We need to sort of have a bit of a dig deeper down. If someone's going once a day and it's painful and it's uncomfortable, then I'd be looking further into that. So essentially, it's not really so much about how often you go, it's more about how happy you are when you do go. So those are the things that we kind of want to address. Symptoms of constipation, obviously, we've got reduced frequency, so you're not going as often. Stools are hard, dry, and painful. They may require excessive straining to get them moving. You may be spending an extended time on the toilet, so realistically, we should be waiting until you get the urge to go to the toilet, going in, doing your thing. You should be in and gone and done within about 5 minutes, maybe 10 if you're sitting there comfortably with your scrolling on your phone on Facebook. That can take a little bit longer, but you shouldn't be needing to sit there for sort of half an hour or something like that. That incomplete evacuation, so that's that feeling of being unfinished afterwards, if you've got bloating or cramping that goes along with it. So those are kind of the symptoms that are involved in constipation. It can be really uncomfortable, it can be really, really debilitating. So I have IBS myself, and traditionally my IBS has always been more towards the sluggish end of the scale. So I know what it's like when it's been several days since you've been and how backed up and uncomfortable that it can feel. It's funny, I often see comments in groups where people are saying that they could do with a little bit of constipation occasionally, and then people with constipation are saying I could do with a little bit of diarrhea occasionally. It's kind of like the grass is always greener on the other side. I wouldn't say that one or the other is better or worse. I think that they are both debilitating in their own way. Constipation, look, most people, in fact, I would say everybody in the population will experience constipation at some point in their life. It's really common occasionally. It's often related to things like a change in diet, a change in lifestyle, changes in medications, those sorts of things. If it's a one-off and it's transient, I wouldn't be too concerned about it. Is when it's happening again and again and again, and you're getting, it's starting to really impact on quality of life. That's when I'm going to start being quite concerned about it, and I'm going to start implementing strategies to manage it and to deal with it. Causes of constipation. So there's a lot of causes of constipation. So one of them could be a blockage in the colon. Obviously, if there's something growing there or something there that's not supposed to be there, that's going to interfere with things coming through. Problems with the nerves that are around that GI tract. So those nerves that are all around your intestines and all around there, they have a lot of impact on how fast or how slow the gut contracts. So we've got this thing called peristalsis, where it's sort of this rhythmic squeezing, and that rhythmic squeezing along pushes the matter through the intestines. And the nerves that are around there are really have a big influence on how quick or how well and how quickly those that peristalsis is occurring. Different muscles that are involved in elimination as well. So sometimes during childbirth, for example, there may be some damage to the muscles on the pelvic floor that can have an impact. Any of those muscles in the abdomen that may be damaged, or if there's something going on there, that can of course have an impact on slowing down the gut and potentially triggering constipation. Hormones, changes in hormones, and this is a big one for us girls. So we've all got this hormone called progesterone. Progesterone, it usually peaks the week or just before you get your period, and then it drops off very quickly when your period starts. The other time that progesterone gets high is during pregnancy, so it gets it actually gets extremely high during pregnancy. And one of the things that progesterone does is it slows those gut contractions, so it can cause constipation. It's really not uncommon for women to feel a little bit backed up or a little bit blocked the week before their period. It's really, I mean, everybody knows that constipation is part of pregnancy as well, and it's the progesterone that is the reason for that. So those hormones do have a really big impact on constipation. People who traditionally have looser bowel movements, sometimes they'll find that week before their period, their bowel movements are that little bit firmer, and they say that's the best week of the month, and it's that progesterone just slowing things down a little bit. If you're prone to constipation, you may skip days during that week as well, so, and that's the progesterone. Obviously, there are strategies that we can use to manage this, which I'm going to talk about shortly. Other influences on constipation, other things that can cause it, are diet, and of course FODMAPs falls into that category as well. So if you're not eating enough fibre, then you're not going to have very bulky stools. They're going to get smaller and harder, and they're going to be more difficult to pass. Diet has all sorts of influences on it. I could talk for a whole session just on diet, so I don't want to go too much into that, but I did want to talk about a little bit about FODMAPs and constipation, because this is something that I see fairly often, and it's something that actually makes a lot of sense when you actually look at it. So the thing about FODMAPs is that one of the reasons that FODMAPs cause gastrointestinal symptoms or digestive symptoms is that certain FODMAP groups draw water into the intestines. Now, if we are eating a lot of FODMAPs and you're drawing a lot of water into those intestines, all that water has to go somewhere, and you're going to end up with loose, watery bowel movements. What that means, when you start a low FODMAP diet and you stop eating FODMAPs, that means that you actually draw less water into your digestive tract. And this is one of the reasons that a FODMAP diet is super, super effective for people with IBS-D or diarrhea-dominant IBS, is because we don't draw as much water. You don't draw as much water into your digestive tract. The digestive tract then dries out a little bit and things slow down. So you could kind of think of it like a river. If you've got a river out in the desert that's a really slow trickle, that's because it's dried out. If you've got a river after a storm and it's a full river and it's flowing very quickly, that's what your digestive tract's like when we've got lots of water in there. And what we want to find is that nice happy medium where you've got enough water in there to keep things moving, but not so much water that you're getting diarrhea on the other hand. So what that actually means is that when people go on a low FODMAP diet, super effective for diarrhea. But some people actually say, look, I've always had diarrhea and all of a sudden I'm constipated and I don't know what to do about it. I've never been constipated. And it's that drying out of the digestive tract from not eating FODMAPs that's triggered that. If people are traditionally constipation dominant IBS, we find that a low FODMAP diet can help a lot with the cramping and the bloating, but they often find that it doesn't always help with the constipation, and it can actually make the constipation worse. One of the things that, if this is the case for you, if you've traditionally had diarrhea and now you find yourself constipated on a FODMAP diet, the best strategy for that is actually to start challenging FODMAPs, start reintroducing small amounts of FODMAPs, and that's going to help you find that balance between enough FODMAPs to keep things moving, not so much of them that you're left running and having to go too often. So that's my number one tip for people who are diarrhea dominant that find themselves constipated: start reintroducing the FODMAPs. If you're still on that really initial elimination phase, that sort of 2 to 6 weeks where you're trying to work out if FODMAP works for you or not, if you're starting to feel constipated, that's a good sign that it is working for you. But if you are not ready to start reintroducing yet, and I would encourage people by about that 4-week mark, if you are not getting results, to see a dietitian to troubleshoot. If you are getting results, that's when it's time to start reintroducing, is around that 4-week mark. But if you are still in that elimination phase and you need some strategies, first line treatment for treating constipation is kiwi fruit. Kiwi fruit have got a little enzyme in them that encourages that peristalsis, gets the digestive tract contracting, and really helps a lot for constipation. So that would be my first line, the things to do. Kiwi fruit, if you're not ready to challenge. If you are ready to challenge, start reintroducing. However, if we've got people that are constipation dominant IBS and they're finding that that's not helping, then we often need those extra strategies to get on top of that constipation to get things moving. So usually just a FODMAP diet alone, look, for some people it does work, but it doesn't work for everybody, and that's when we need to bring in some of those extra strategies. So some of my strategies for managing constipation with food and with diet are that one of the first things we're going to do is, like I said, my first line treatment is kiwi fruit, 2 kiwi fruit a day to get the gut contracting and get things moving. So that would be the first thing I'd start with. If you're allergic to kiwi fruit or you can't eat kiwi fruit, for one reason or another, then obviously that's not going to work for you. So the next thing we start looking at is the amount of fiber in your diet. So fiber is the part of food that is not digestible by humans. So in one end, comes out the other. As it passes through, it creates a medium for taking the parts of food that we don't need out of the body. So it actually is what the bulk of your stool is made from, is fiber. If you're eating a lot of fiber, then you're going to have quite large, bulky stools. If you're not eating enough fiber, you're going to have quite small, hard stools. There's a few different types of fiber. In the old days with IBS, the doctor used to say, just go and eat more fiber and that'll take care of it. We now know that there are some types of fiber that are not well tolerated by people with IBS, and there are some types of fiber that are much better tolerated by people with IBS. And that tends to be that balance between the soluble fibers and the insoluble fibers. The soluble fibers, these are the ones that are really well tolerated by people with IBS. They tend to, soluble means they dissolve in water, so in the gut they soak up that water, they make the stools big, they make them soft, they make them bulky and easier to pass. And you find things like your soluble fibers in oats, you find them in flax, psyllium husk is a soluble fiber, partially hydrolyzed guar gum, that's also a soluble fiber. We see them in fruits and veggies, so making sure that you're getting your 2 fruits or your 5 veg a day, that goes a long way towards getting your fiber in. We see them in whole grains, and when we're talking about whole grains in terms of FODMAPs, we've got our sourdough breads, we've got our low FODMAP certified breads, are really good sources of fiber usually. We've also got our nuts and our seeds, which are low FODMAP and have lots of low FODMAP serves in them. With nuts, we're just being careful of things like cashews and pistachios, which are high FODMAP, but all other nuts are low FODMAP or have a low FODMAP serve size. And also our legumes are a really great source of soluble fibres. So things like canned lentils are low FODMAP at a half cup serve. Canned butter beans and canned chickpeas are also low FODMAP at a quarter cup serve. And they're great sources of fibre as well. We've also got these insoluble fibres, and insoluble fibres, they don't have they do have some bulking effect, but the insoluble fibres, these are the ones that actually increase that gut transit time. So they're super valuable for people that are constipated, but they're also the ones that are usually not very well tolerated on a low FODMAP diet. And we find those in things like your bran, which we know is poorly tolerated. We do see little bits in things like fruits and veggies and whole grains as well, because most things have that mixture of soluble and insoluble. But the thing, so insoluble fibres, they're not well tolerated, but they're really great for keeping the gut moving. We actually do have one FODMAP certified fibre that is an insoluble fibre, and this is one that you've probably heard me talk about, because the difference is it's an insoluble fibre which helps get things moving and decrease that gut transit time, but it's also FODMAP friendly, and there are very few of these around. And that one's the K fibre, so that's that one there. Highly recommended if you do have a bit of constipation. It really can make a big difference. I'm finding that I'm using it as my one. I'm actually preventing the need sometimes for an elimination diet by bringing some K fibre in and getting things moving. So that one's a really beneficial one to have in there. One thing to mention, that in terms of fibre, you do want to make sure that when you start on it, if you're going to start on a fibre supplement, you start small and you increase slowly. If you go too hard too soon, your gut can get a bit of a shock. The other thing that you need to do when starting a fibre supplement is making sure that you drink plenty and plenty and plenty of water. There needs to be something for that gut to soak up. If you're having too much fibre and not enough water, that will end up having the opposite effect, and that will cause constipation. So, and we actually, that's a strategy that we use for people who have diarrhea dominant, is that we start them, we pop them on a good soluble fibre and let that and soak up that water to treat the diarrhea. So usually with constipation, we're looking for smaller serves and making sure that you're drinking enough water with it. Other treatments for constipation, obviously we've got medications and that can help with that as well. And by that I'm talking about laxatives. There are a few different types of laxatives that I'm going to talk about quickly. So we've got our stimulant laxatives, and these are things like your Coloxal, your Dulcolax, and they work by stimulating that gut to contract and stimulating that peristalsis to get things moving. Now, these types of laxatives are not recommended for long-term use. The body can become reliant on them, so we're using those for one-off situations where things might get sluggish, where it might be a short-term thing. The other thing that we use stimulant laxatives for are when the constipation is actually triggered by side effects of medications. There are some medications, in particular your opiates, that cause constipation as a side effect, and the reason that they cause the constipation is that they slow down those gut contractions. Now, if those gut contractions are slowed by a medication, more often than not, we actually need to use a medication to get those gut contractions moving again, and that's another situation where we might use stimulant laxatives in the short term. Okay, I really want to stress these are for short-term use. Obviously, I will also put in here, before you go taking any medications, please speak to your doctor or your pharmacist. Without knowing people, I can't recommend what's right for you and what's not right for your situation. So I'm just here to provide the information, may or not be relevant to your situation. So we've got other types of laxatives. We've got osmotic laxatives, and osmotic laxatives work by drawing water into the digestive tract, lubricating the bowel so that things move through much more easily. Osmotic laxatives are things like Osmolax, Movicol, magnesium supplements. So they're all osmotic laxatives. They can be really beneficial to constipation in some people. So some people need them, some people don't. Osmotic laxatives, I find these can be quite effective when combined with a fiber supplement, which is a bulking supplement. So sometimes in my practice, if someone's got quite stubborn constipation that's not responding to fiber and kiwi fruit, we might combine a fiber supplement and an osmotic laxative together to get the bulk from the fiber and the lubrication from the osmotic part. Osmotic laxatives are usually fairly safe for long-term use, but of course, if you are going to be using them long-term, make sure you speak to your doctor about it as well. Other types of laxatives, we've got our bulking laxatives, and they're pretty much our fiber supplements, which I talked about just before. Your soluble fiber supplements like your PHGG, your psyllium husks, and your insoluble ones like your K-fiber, which are your bulking laxatives. The other one we've got is those stool softeners, and again, they work just by softening the stool so that you're getting soft. Instead of small hard stools, you're getting sort of softer stools. They don't bulk, but they soften. So those are medications and supplements. The last thing, there's a couple of more things I do want to touch on, because behaviour can absolutely have an effect, and positioning. So making sure that you're getting enough exercise is really good for digestion. If you're really sedentary, that can slow things down. So if you are sitting at a desk job like me where you've got a sore bum at the end of the day, you want to be getting out for a walk at lunchtime, getting things moving. You don't have to run a marathon, but we do want to keep things moving. You might go downstairs to get to the toilet. You might get up and go for a walk around to get a drink every hour or so, just to get that incidental exercise in. Parking a little bit further away from the door when you're going to the shops or when you're at work, those sorts of things to keep things moving. Squatty potties. Squatty potties are amazing. In Western society, we have these upright toilets where we sit like we're sitting on a chair, and there's actually a muscle that goes around the very end of the digestive tract that sort of kinks off that colon, so that when you're walking around all day, you're not pooping, which is awesome. The thing is, when you're sitting in a chair situation, that muscle is still wrapped around and it's still a little bit kinked off. Whereas when you look at Asian societies where they're using those squatting toilets, where you're squatting, that actually releases that muscle and puts the colon in alignment to empty itself. So one of the things that you can do is get, in the old days we used to say a couple of telephone books, you might get a couple of toilet rolls, you can go down to the chemist, and I saw them at Chemist Warehouse just recently, a squatty potty, and what that does is it raises your feet off the floor, you lean forward, and that gets that colon in alignment for ease of emptying. So that can make a really big difference to managing constipation. Last thing about behavior, routine. Our bodies love routine, and they respond well to routine. If your body knows that you get up in the morning, you have breakfast, you have your coffee, and then you go to the toilet, when you start that routine, your body will start to prepare for what's coming next. So trying to get some sort of routine in there in terms of your toileting times, your toileting habits is really, really, really beneficial, and your body will respond quite well to that. The mornings are quite good. So often we find that the gastrocolic reflex is stronger in the mornings, and when you have something to eat, that gives that gastrocolic reflex a kick. What that means is that when you eat, your body sends messages to your gut saying, hey, there's more food coming, you need to move things along and make room for the next food that's coming. So if it's stronger in the morning, often having breakfast will give that gastrocolic reflex a kick, and then go and sit yourself on the toilet for 5 or 10 minutes. The other thing is that coffee is really beneficial for giving that gastrocolic reflex a kick as well and getting things moving. So having a coffee within a couple of hours of getting up in the morning, that can be really helpful, and for some people that's all they need to get things moving, and once things are moving, they're actually really good. I will mention probiotics. Sometimes I use these to manage constipation, sometimes I don't. Probiotics are really individual. Our gut bacteria is there's more bacteria in our gut than there are stars in the Milky Way. They outnumber the cells in our bodies by trillions to one. And they're all very different. Gut bacteria are more individual than fingerprints. So what that means is adding in a probiotic. Probiotics behave differently in different people. So there is no one rule. There are some probiotics that are shown to be better for constipation. There are some probiotics that are shown to be better for bloating. There are some probiotics that are shown to be better for diarrhea. But again, there is no guarantee that they will help you. There is no guarantee that they won't make you worse, and there is no guarantee that they will do anything at all. So sometimes that's a little bit of trial and error to find the one that's right for you. If I am going to use a probiotic for constipation, one of the ones that I would normally start with is one called Meta-Align. It does have some research behind it for constipation. I will make a little note here that if you are in the elimination phase of a FODMAP diet or the elimination phase of the Raw Prince Alpha diet or any other diet, you want to know from that elimination phase if the diet is working or not. And changing medications and changing probiotics during that elimination phase will skew results and cloud results. So I recommend if you're not taking a probiotic and you're doing elimination, get through that elimination phase first, find out if the diet works for you, if the diet has an influence. Then once you know that, that's when you can start playing around either with reintroducing and managing things through diet, or you may then choose to trial a probiotic. You may choose down the track, once you know exactly what your triggers are, you may choose to trial a probiotic as well to see whether that helps you or not. Lastly, see a dietitian, see your doctor. Everything I've talked about today is the general rule. It may or not be relevant to you. There may be parts of it that are relevant to you and parts of it that are not relevant to you. The only way I can actually say what fits your situation is by assessing you. So I need to sit down with you. I need to know your medical history. I need to know your symptoms. I need to know what you're eating. I need to know what you've tried. I need to know all of that stuff. Then I can put all of that together and I can actually give really targeted information, really targeted advice on what is probably best for your situation. So if you've tried a few things and they're not working, absolutely see your doctor, have a chat to your doctor, see a specialist dietitian and have a discussion there. So that's all I've got to say about constipation. I just noticed that there is one question there. I'm assuming that's about K-fibre, is that correct? Whether K-fibre is an Australian product. It is an Australian product. It's from Queensland. The K-fibre website does ship internationally, so you can go to www.kfibre.com. Online orders have a 10% discount with the code GUTLOVE10. And they will ship anywhere in the world, and the shipping costs are really reasonable. If you're in North America, there is K-fibre is in North America as well. It's in Canada and it's sold under the name Happy Gut. So Happy Gut is the same product, and you can jump onto the Happy Gut website and you can order it from there as well. So yes, it's an Australian product, but yes, it's available everywhere in the world. If you're in North America, it goes by the name Happy Gut. If you give me 2 seconds, I have a bag of Happy Gut. Hang on. Here it is, Happy Gut. So for Canadian people and for both the same product, Happy Gut in Canada, K-fibre in Australia, all available internationally. That's it. So I will say goodbye. I will say have a lovely Wednesday. If you're wanting to connect with me, obviously you can message me. You can find me in Low FODMAP Australia, so that's the Facebook group that I admin. Obviously, Everyday Nutrition is my Facebook page. If you're on Instagram, you can find me at The Gut Health Dietitian. If you're on the internet, www.everydaynutrition.com.au. We are gut health dietitians. We are all FODMAP trained. We all specialise in IBS and food intolerances, and we offer virtual consults. So hopefully we will see you soon. Take care. Have a lovely day. Bye.